Did you know there's a serious disease that can affect dogs, especially if they're not vaccinated? It's called Infectious Canine Hepatitis, or ICH. What causes infectious canine hepatitis? ICH is caused by Canine Adenovirus Type 1, CAV1, a tough virus that can survive for weeks on surfaces, making it highly contagious. How dogs get infected. Contact with infected urine, feces, or saliva. Virus can be shed in urine for up to 9 months after infection. Puppies are most at risk, but any unvaccinated dog can get sick. Virus pathway in the body. After entering the body, the virus travels through the bloodstream and attacks the liver, kidneys, eyes, and blood vessels. Symptoms of infectious canine hepatitis: high fever and vomiting, belly pain and jaundice, yellow gums or eyes, bruising and cloudy blue eye, corneal edema. Diagnosing ICH. Veterinarians evaluate symptoms, vaccination history, and conduct blood tests. Special tests confirm the virus's presence. Treatment options. No specific cure exists. Supportive care like 4 fluids, medications, and sometimes blood transfusions help recovery. Preventing ICH. Vaccination with CAV2 protects safely against ICH. Puppies start vaccines at 6 to 8 weeks old with boosters until 16 weeks. Regular adult revaccination is essential. Additional prevention tips. Maintain good hygiene and use disinfectants. Isolate sick dogs promptly. Critical in shelters and kennels. Infectious canine hepatitis is rare where vaccination is common, but still a threat where dogs are unprotected. Keep your dog safe, vaccinate, and help stop the spread. Talk to your veterinarian about ICH prevention today.